Hi everyone. I'm here to talk to you about preparing children for adulthood, children with chronic illness for adulthood. As a pediatric nurse, I've worked almost 13 years with children with chronic conditions, and I can see the lights are bothering you. Do you mind if I move? I guess I'm not that tall. Sorry, not a good way. Sorry. So I've worked with children from about 11 to 13 years, and I've worked with children from infancy all the way through adolescence. And I'm really proud as a peds nurse to say we do a great job in peds and helping children survive. Children with CF now, those who are above 18, actually live nowadays at more and more numbers of children above 18 live longer, and so we've done a good job with that. Children with sickle cell, a similar picture. We've improved their mortality rate from age 14 to age 50 and 40, and so this is a huge advancement. If all's well in the world, let's eat. No, we have not done well. We've improved their life expectancy, but we've not given enough attention to their quality of life. We've not given enough attention to ensuring that they have a productive life in society as adults. And so, while we have improved their life expectancy, as you can see in children with sickle cell, in adults, the mortality rate is increasing. As they get older, adolescents and young adults have higher rates of complications, so they have more crises, more admissions, and more emergency service utilization. And so we've not really done well compared to younger children. We have not done well in the older children and young adults as we have done in adolescents and younger children. Also, the other thing, comparing to their peers, their healthy peers, they are at increased risk of dropping out of college. They're at increased risk of not having a job and engaging more in risky behavior such as drunk driving and drug abuse. And so while we have done such a great job and have been very successful in improving their life expectancy, we have not done such a similar or a successful job in improving their quality of life. And so today, about 1 of 4 children or 1 of 4 youth ages 18 to 21 have a chronic condition. That's about 4.5 million people. That's a lot of people. What we're trying to do today is we're trying to help address their needs by transitioning them to adult care, by moving them from a peds-oriented service to more of an adult-oriented service so that we can address their high-risk needs in a better and more comprehensive way. So transition to adult care is basically a process that starts about age 12 throughout adolescence, continues throughout adolescence, and all the process entails is preparing the young adult, the adolescent, to be more independent in their self-management, so teaching them self-management skills and teaching them life skills in general, how to look for a job, how to prepare for college, and all those basic needs that we take for granted. So this process should take time, starts at 12, but it should actually continue throughout adolescence. And it's not the simple transfer from a peds service to an adult service. Our job as providers, as nurses, is not to make an adult appointment for a child who's 18. Our job is to work with them all through that process from age 12, preparing them to be independent, and having them schedule their appointment at age 18. So this is relatively a new area of research. Most of the work that has been done has really focused on the process itself, the programs that have been developed, and some tools that assess the adolescent's readiness for transition. One of them is actually at UNC. And so most of that research has focused on the process and the satisfaction with the care and kind of preparing the child for, or the adolescent for the transition. We really don't know if this is the solution. We really don't know if this is going to improve outcomes. Is it going to be that they're going to have less admissions? Are they going to have better health outcomes? Are they going to be more successful as adults? So this is what I'm doing right now. My interest is, my research interest is looking at this process of transition, and I'm looking at children who have been seen at the Duke Health System for the past 19 years in the sickle cell clinic, and looking at their healthcare utilization and health outcomes over time. I have data over 19 years, and I'm kind of looking at their trajectories of healthcare utilizations and health outcomes over time. But I want, if you leave with one thing from this presentation, what I want you to leave with is our role as providers and nurses and doctors does not end by helping children live. Our role is to help them live well. And so that's what I'm trying to do with my research. Thank you.